Okay, so I have Dr. Rauof Hajji. He is a professor of internal medicine. I met Dr. Hajji during the MIT COVID-19 challenge. He was a mentor, very intelligent, very well versed on the virus, everything going on with it. So I wanted to take an opportunity and thank you for taking this interview to ask you a few questions about COVID now that we're, a few months in and we've seen different stages of it. So thank you for joining me.
Thank you very much for the invitation, and I'm happy and glad to contribute to explain to the public what is COVID-19, what are the challenges of COVID-19, and how this outbreak is affecting our lives. And then think what you are offering now is excellent to explain all these challenges.
Yeah, appreciate all your information and insight in the past. That's why I thought it'd be so useful for you to, share with the broader audience. So I wanted to ask you, the U.S. has reopened. There's, from what I'm personally seeing, social distancing is being loosely enforced, and people are now kind of protesting, even wearing masks. What are your thoughts on this?
Yes, as the contamination by COVID-19, by SARS-CoV-2 or coronavirus, as commonly known, is always by droplets. So the best way to avoid this heat spreading and this transmission is the social distancing, because even when we talk, even when we cough, we can transmit our droplets full of coronavirus to the other individual who is near us. So the social distancing, at least 1.5 meters or more, could be very useful to avoid the spreading. And why it's interesting, because we don't know if the other individual has the virus or no, because he could have no symptom, but he's carrier of the virus, and he could transmit it to me, and he could cause me disease, and maybe I will transmit this for other members of my family or my teammate at work. And that's why it's the easiest scheme of transmission of the COVID-19. So the best way is that we should wear masks, and we should keep always the distance between us, as to avoid this transmission of the droplets full of coronavirus. And I think what was shown in Asian countries, where they are used to have masks because of past virus outbreak like SARS. They have the habit to use the mask, and they have the habit of social distancing. That's why the number of cases in these countries is lower compared to other countries like European countries, like in USA, like in Brazil.
So as far as the mask goes, so it's transmitted by droplets, and you could have no symptoms, and the risk is obviously older people or people with underlying health issues or pre-existing health issues have a pretty high mortality rate, so we're protecting others. As far as droplets, let's say I sneeze on my hand, I have COVID, and I touch door handle. Someone else touches that door handle, and then they touch their eye. Is that another way to transmit it?
Yes. All the human secretion could contain the virus, and this is the issue, because the transmission, the virus could be present in the surfaces, and it depends on depend on the type of the surface. It could start from 1 hour to many hours, and it could contaminate anyone who touched this, and could because we are unconsciously using our hand to scratch our mouth, to touch our mouth, to touch our eyes, our nails, and they are all ways of transmission. And when the virus has the access to the mucus, to the ear, to the eyes, to the nose, to the mouth, it could attack the respiratory system, and this is another way of transmissions. And I think that we should underline that WHO has said that the non-symptomatic patient who has COVID-19 transmit rarely the virus. I underline the word rarely. Doesn't mean they don't transmit. They transmit, but is a lower percentage compared to the patient who are infected and who has symptom. Because if they have symptom, almost they have more amounts of virus, and they haven't enough immunity to protect them from the manifestation of the virus. And this is the idea that many people didn't understand well. So the best solution is that we should have always the idea that in crowds we should avoid to be near contact with any other individual, and we should wash our hands what we are touching, and this is the best solution for us and for our families and for our teammates in the work. Because maybe we are healthy and we have nothing, and maybe the virus could attack our body, but we didn't have manifestation. But the problem that we could be a carrier and transmit this virus to people who have comorbidities like diabetes, like hypertension, like stroke, like myocardial infarction, who are not able to protect themselves and to face the disease of COVID-19.
You know what's interesting? I spoke to a friend a couple days ago. She lives in New York, and you know, we hear about what happens in New York, and New York is so densely populated and people are close. She just lost her father to COVID. Her mother caught it. She said, you know, 1 in 4 of her friends have lost someone close to them. In some areas, they're complaining about the smell of dead bodies. And, you know, that kind of was kind of hit home, because they're seeing it, you know, they saw it first, and people are close there, and you know, we kind of see how it spreads without social distancing. So I guess my follow-up to that is, now that people are back out and a lot aren't wearing masks, so the droplets could go anywhere, how long does it take for us to see, we've seen the rise in the number of cases. How long does it take to start to see the number of deaths? Because I think that's what people are watching, and they're saying, well, the deaths are down. Is there a period from, you know, when most people catch it to kind of an expiration date?
Yes. To explain the disease, when it contaminates the body, it takes almost between 2 till 14 days. This is the mean case, but it could exceed, it could arrive until 27 days before the symptoms appear. And the question, in the mean, it could be but between 2 days to 2 weeks. So the patient may be contaminated, but he will have the symptom from 2 days to 2 weeks. So the number of deaths is not directly easily understood and easily linked to the contamination, because there are we can delay the number of deaths because of the treatment, because of the social distancing, because of hospitalization of patient, and usually the peak of deaths appear after the peak of after almost more than 2 weeks after the peak of new cases. So
yes, we've just reopened, so we probably wouldn't be seeing the death rise quite yet then.
yes, logically, if there is no intervention, if it's natural evolution of the disease, maybe for example, we have a peak now in 26th June in new cases. In 2 weeks or more of 2 weeks, we can see a peak of deaths, but there is the intervention of the hospital, there is the treatment, there is the management of the disease could reduce the number, and maybe there are too many factors that could explain the reduction of the number of the deaths. One is the patient himself. Maybe you are contaminated, but you have no symptom, but you will never have any symptom, and you will know the evolution is usually will be cured in few weeks. The second thing is the intervention of the healthcare system, which is the treatment. The treatment could save lives and could reduce the number of deaths because of efficient intervention. And the second thing, that maybe you have the disease, but when you are applying social distancing and masks and using all the safety precautions, maybe the transmission will reduce, and maybe you will not transmit the disease, and the number of cases will reduce.
So what are you seeing in other countries, or hearing from other colleagues as far as countries that have put in place masks and protective measures, and then countries who haven't been able to or have ignored it? Have you seen a difference, or what's it look like around the world?
Yes, I will give you the example of the Germany and Italy. Italy, because of the decision of lockdown, and the population is not, the public is not convinced of the use of masks and the social distancing. There is big difference between the number of cases in Germany and in Italy. And when we compare, for example, USA and Asian countries like Japan and Korea, we see the big difference. And there are some countries in Asian region, like South Korea, like Taiwan, which didn't apply even the lockdown. They apply only the use of masks and the social distancing. They didn't, for example, Japan and South Korea, they didn't close schools, they didn't close the work offices, and because they are convinced of the efficiency of the population, the public education, and the rules and the tools that they have applied, like wearing masks and social distancing, has shown its efficiency. And the most important thing is, another thing is important, is that hand washing, social distancing, and using masks. And another thing, which is the use of the maximum of tests, because when you are you have the virus and you are not tested. You are not conscious of the risk that you could transmit this disease to your family, to in the work. And when you have the test, even when you didn't have the symptom, you know that you have the virus. So you will be more careful. You will be more attentive, and even in the example in South Korea, they are tracking these cases, these individuals, and they explain and they use application that can track this patient, and when you are near them, you know that you are near some cases of COVID-19, so you will take your precaution and be distant and far from them. And this is the idea.
So if we simply wear masks and keep our hands clean, we can go out and function, and we can keep it low. But if we don't wear masks and we aren't minding social distancing and sanitizing, we're on a track for some pretty bad numbers. Am I hearing that right?
Yes,
so
this is the idea.
It's pretty simple.
This is the idea, and wear a mask is not only you should wear mask. It's you and the other one, the other individual should wear mask, because there is difference if you wear a mask. And I think the most important thing that the use of masks and the hand washing and social distancing should be applied for all the population, because if it's applied by only a part of the population, the transmission still it will be still there. And this is the question. This is the issue and the challenge. When it's applied by all the population, is the most efficient possible. When it's applied from part of the people, the efficiency will increase. For example, when almost when you are far from someone more than 1.5 meters, and you and him, he is wearing wearing masks, the transmission is reduced at by 95%.
It's pretty big numbers.
This is very efficient.
It's kind of like if if everyone had their water from one lake, right? And then you found out the lake was contaminated, but you had a chance to purify your water, so you could, reduce the contamination. So basically, we know the water's polluted. We have the means to purify it, but some people just want to drink straight out of the lake.
Yes, that's the idea. Yes.
An analogy I think of, because the preventive measures are so easy. As far as symptoms you've seen or mutations, have you seen any change, good or bad, or mutations or anything specific to any particular type of person or age group or anything like that?
Yes. Just one remark about the masks. When a COVID-19 carrier, I mean the one who is symptomatic or asymptomatic, is not distant and is not wearing mask, the contagion is probably 70%. There is the risk of the contamination by 70%. And if the COVID-19 carrier and he is wearing the mask, and the non-COVID-19 individual that didn't wear, the transmission is 5%. The idea, when both of them are wearing masks, the transmission is 1.5%. But the problem in the second case, as I have explained, the COVID-19 carrier wearing mask, and the other one, which is non-COVID, is not wearing mask, is 5%. But we don't, even yourself, you don't know if you have COVID-19 or no, because even if you have no symptom, maybe you are carrying the. So the easiest solution is to wear masks, social distancing, and hand washing. I return for the Yes.
right? You know, it's like wearing a seatbelt or any protective measure. So I mean, I bring this up, you know, the simple logic or analogy of a seatbelt or contaminated water, because I'm suddenly seeing in the US, people are really fighting this mask thing more and more. Are you seeing this in other countries? Are other countries having resistance to wearing masks?
Yes, it is not usually is not common, but it was seen especially in European country, especially in Italy, and you
Mhm.
see the result where we were when we were very surprised by the number of cases in Italy compared to other countries, and maybe there is no resistance in other and low income countries. There is no resistance, but there is no access to masks. This is the problem.
Yeah.
There is the ones who have masks and refuse to use it, and the ones who didn't have the masks, and this is the result will be the same. And the most important, the most evident example of the ones who resist to have to have masks is Italy. And Italy, the spreading is very quick and very rapid.
Interesting. Uh, are there any other thoughts you have on the future of, you know, this pandemic or COVID, and any predictions, any advice to anyone? Because I think there's some uncertainty, and I think a lot of people were really scared of it, and now people are more protesting the idea of it being real or not. What?
Yes, I think there is no doubt of the reality of the COVID-19, and everyone has lived in the front line and has seen the deaths, have seen his colleagues fallen sick, and have lived has lived as COVID-19 patient. The description of the disease and the symptom of the disease are not descriptable, and it's very hard to face to have the COVID-19. So I think that everyone should be responsible for his action, and because his action could cause a consequence, fatal consequences in other in his in the member of his, on the member of his family, and anyone could be victim of his attitude. The most this is the responsibility of everyone, because when you have the virus, maybe you will not fall sick. Maybe you have the good chance that you didn't fall sick, but maybe you can cause the death of someone who is dear for you, and this is the problem. And the solution is easy. We should have the habit to wear masks whenever we go out. We can work with. We should wash hands whenever we touch anything, because everything could have could carry the virus, and the social distancing is very important. So there are three pillars of the attitude, of human attitude, individual attitude, could save lives, could save money, could save. It's very important, and I think this simple these simple actions are crucial for the management of the outbreak. And we don't know exactly when it will finish, when it will rise again. So we should keep attentive and careful, because the virus could contaminate us, could contaminate any member of our family. And the measure word that I think we should use, that we should be responsible. I have seen many colleagues are dying. I have seen many colleagues who are fallen sick, and they say it's unbearable. It's not supportable to live with COVID-19. You feel a chest oppression. You feel a dry cough. You feel unbearable headache. You feel that you are dying every day. And if you have the chance to live, you think that the simple actions could save lives. And we should know how it's difficult to lose someone who is dear for us.
Yeah, unfortunately. I wanted to go back to one thing, because I'm not sure of the answer, and I'm sure many others aren't. As far as asymptomatic individuals, are there people carrying the virus that may not have that spike in temperature? You know, a lot of checkpoints or public gatherings, restaurants, establishments have those thermometers and you know, to check heat on foreheads and whatnot. Are there people that wouldn't have a spike in temperature who are asymptomatic? Yes. So that does exist.
Yes, the idea is that anyone could have the virus, but he could have no symptom at all. No cough, no fever, no fatigue, no loss of smell or taste, nothing. He will have nothing, but he has the virus. Why we call it carrier? Because he's carrying the virus only. The virus is not doing anything for him, on him. There is not affecting him, but he's using him as a carrier that could go from him to another one. And this is the idea. The measuring the temperature could be useful, as we say that symptomatic patient, for example, a feverish one person can contaminate more than non-symptomatic. But this doesn't mean that non-symptomatic can transmit. So by precaution, we should not forget to use masks, forget the social distancing, forget the hand washing, and if necessary, we go out only for necessity. And I think if we are acting correctly and adequately, the number of cases, new cases, of the number of deaths will decrease. Sorry, will go down.
Well, that's very good insight and information, and thank you for taking this time to share it and educate people. I learned a good deal as well. So yeah, I guess the key takeaway: wear a mask, wash your hands, and it's about protecting others, and that's how you stop the spread.
Yes. This is the idea of the public health issue of the pandemic. It's by my responsibility. I could say by doing responsible action, I could save lives. Even whatever I could save lives because I'm doing what I should do.
Thank you, Dr. Hajji.
Thank you very much, and I hope the message is clear for all the public. Thank you.